Assalamualaikum. Good morning.
Waalaikumsalam. Good morning.
Are you Mr. MKN?
Yes, I am.
Please have a seat.
Thank you.
My name is Muhammad Faris Aiman and I'm your pharmacist in charge for today. So today I want to counsel you about this medication that you will be used later. So may I borrow your time, probably about 10 minutes?
Oh, okay.
Okay, before we start, may I ask you several questions? Do you have any medical conditions such as renal impairment or hepatic impairment?
No, Mr. Ahmad.
Do your family have any chronic diseases?
No, Mr. Ahmad.
Do you have any allergy to any medication?
No, Mr. Ahmad.
And do you take any current medication? Are you on antibiotic, painkiller, or any traditional medicine?
No, Mr. Ahmad.
Do you take any supplement?
No, Mr. Ahmad.
And I'm sorry to ask you a sensitive question, but do you smoke or take any alcohol?
No, Mr. Ahmad.
Okay, good. So, for your medication, we will start with metformin 500 mg. This medication is for your diabetes mellitus, which is to reduce your blood glucose level. You need to take this medication 1 tablet 3 times daily after your meals. The amount that we supply to you is 90 tablets, which is for 1 month. The side effect of this medication is that you will feel hypoglycemia, which is the state where your blood glucose level is very low. So it is important for you to keep sweets, simple sugar that can prevent you from falling or fainting. This drug has drug interaction with insulin, which can also cause hypoglycemia. So it is important for you to adhere to the dose that we will tell to you. This drug also have drug interaction with painkiller such as NSAID. The second one is furosemide 40 mg. You also, same with metformin, you need to take this medication 1 tablet 3 times daily orally. This medication is for your heart failure and it acts through reducing your body fluid volume through its diuretics effect, which is increasing your production of urine. So, the side effect of the medication is that because of it can reduce your body fluid volume, so it can cause loss of electrolyte and also too much loss of your body fluid volume. As a result, you will experience hypotension, which is very low blood pressure and also abnormal breathing. So, I will suggest to you that you do not drive or operate any machinery after taking this medicine. This medicine also have drug interaction with painkiller such as NSAID and also antibiotics such as aminoglycoside. The third one is perindopril 10 mg. Also, to treat your heart failure, you need to take this medication 1 tablet daily through orally, through mouth. and we will supply to you this medication 30 tablets for 1 month. The side effect of the medication is that you will feel hypotension, a very low blood pressure, dizziness, and also dry cough. The drug interaction of the medication is with antihypertensive drug and also anti-diabetics medication. So it is important to you also to stick to this dose that we had told to you. Okay. If you had missed any of this dose, please take it as soon as possible. However, if the next dose is near, please skip the dose and proceed to the next dose. Do not take any double dose at one time. The second last one is betamethasone 50 gram, which is used to treat your eczema, and aqueous cream for 50 gram to as an emollient. Use these two to 3 times daily. And for betamethasone, please avoid any allergens that may cause your symptoms to worsen. Use both of these medication until your eczema resolves. Please remember to store this medication in a cupboard which is protected from sunlight and moisture, and keep it also not in reach of children. Please note that we supply all this medication for 1 month only. So for the next month, you will need to come back and restock your medication on 15 July 2020.
The last medication is insulin. This is an insulin pen which is prescribed for your diabetes mellitus. As this pen is the new one, so we need to do priming to ensure that this pen is working properly and can deliver the right dose. As you can see from the picture, this is an insulin pen which consists of components such as the cap, plunger, insulin reservoir, label, and dose adjustment dial and button. The first step is you need to attach the needle onto the pen and remove the outer and inner cap. To prime, you need to dial the lowest unit, dial about 2 units, then hold it upright, and then press the plunger to see if any droplet available at the tip of the needle. If you can see the droplets, it means that your pen is working properly. Next, you can dial to the prescribed dose to you, which is 20 units. Then you can inject to the specific area such as arms, abdomen, or thigh. Usually, we would recommend you to inject on abdomen area. Pinch your skin on abdomen, then inject the insulin pen 90 degree. Press the injection button until the dial shows to 0. Wait for up to 10 seconds to ensure the insulin delivered completely to your body. Make sure that your next injection are at different part, not at the same site of injection, and ensure 3 fingers away from your belly button. When the injection is done, you need to remove the needle. Cap the insulin pen. This needle can be used up to 3 times. After 3 times, you need to discard it properly in a sharp container and keep out of children. The reason you need to change the needle to a new one is because it can cause pain during injection as the needle becomes blood. The used pen can be stored in room temperature and it can last up to 28 days. After that, you need to discard it. While for the unused insulin, you need to keep it in a refrigerator in chilling part, not near to the door and not in the freezer. The expiry date of unused insulin is usually written on its label. Since the insulin may reduce blood sugar rapidly, it may cause hypoglycemia. So, the symptoms of hypoglycemia were shivering, palpitation, sweating, and dizziness. So, if these symptoms happen, you can take simple sugars such as sweet, candy, or drinking juice. Do you understand? Just to make sure that I didn't leave anything out, can you demonstrate on how you are going to use the insulin pen, its storage, and its expiry date? Uh, Thank you for your time, mister. See you again.